From Idaho's News Channel 7, this is Viewpoint.
Welcome to Viewpoint. I'm Doug Petcash. It happened this week, a major development in the ongoing fight against COVID-19. The Food and Drug Administration gave full approval to Pfizer's COVID vaccine to be given to anyone 16 and older. Approval means the shot can stay on the market after the pandemic ends. It also means Pfizer can advertise the vaccine directly to consumers. Health officials hope full approval will lead more people to get vaccinated. It could also lead more businesses and schools to mandate vaccines. The vaccine will still be available under emergency use authorization for kids between the ages of 12 and 15 and as a third dose for certain people with compromised immune systems. Also, U.S. health officials recently recommended all vaccinated Americans 18 years and older who received the Pfizer or Moderna vaccine get booster shots 8 months after their second doses. This does not apply right now to the Johnson & Johnson vaccine. These developments happened as COVID case numbers and hospitalizations rise, fueled by the more contagious Delta variant. As of Thursday morning, the state of Idaho is reporting more than 216,000 total COVID cases since the beginning of the pandemic. The 14-day average of new cases per day as of August 25th was 681. That's up from just 66 cases per day on July 5th. The percentage of tests coming back positive, the positivity rate, is now about 13%. It was just 2.8% in early July. The state reported 436 people in the hospital with COVID-19 this past week, 135 in the ICU. Both are still near record highs. Health leaders say nearly all of the COVID-related hospitalizations and deaths are of unvaccinated people. Switching to vaccinations, thousands more Idahoans have received a COVID-19 shot over the past week. The pace is ticking up. As of Thursday morning, more than 808,000 Idahoans had received at least one dose of a two-dose series. Of those, more than 724,000 Idahoans were fully vaccinated. While those rates are seeing an uptick, only 48% of those eligible for a vaccination are fully vaccinated. That's people 12 and older. Joining me now to talk about the ongoing fight against the coronavirus amid the Delta variant surge is the state of Idaho's top infectious disease expert. Dr. Christine Hahn is the state epidemiologist. Good morning, Dr. Hahn.
Good morning.
So first of all, let's talk about the big news from the federal government this week. How big of a deal is it that the FDA gave full approval of the Pfizer vaccine for use in those 16 and older?
Yeah, it's a really big deal. We know, first of all, it assures us that the FDA has now looked at not only the initial data that was used to let this vaccine be used for emergency use, but has also had time to look at follow-up data. Now we know they're tracking people longer. Pfizer has provided more data to show that people who got vaccinated months earlier in their clinical trials are still doing well, are still protected. So the fact that we have that assurance from the FDA is a really big deal.
Do you think or hope that full approval will spur more people to get vaccinated?
Yeah, I think so, and I do hope so. I know there are people that are nervous about how quickly the vaccine was developed. They wanted to have some time go by and see how people did that got vaccinated, but they're starting to get more comfortable now, some of those people, and realizing that those of us that got vaccinated back in December, back in January and February are doing well. For the most part, we still have good protection against severe disease, and I think people are more comfortable now. And I think just being fully licensed just adds to that.
I know it's only been a few days, but has the state seen a bump in vaccinations since the announcement?
Yes, we have. We saw a bump almost immediately. I think there are a couple reasons for the bump. We've talked about it. First of all, there's some parents with back to school who do want their kids vaccinated that brought their kids in. There are some people that with all the news about the Delta virus, just said that variant is just a little bit more worrisome. I'm going to go ahead and get the vaccine. And there are some that the licensing, I think, probably made the difference. So I think we have a mix of things going on, but we are seeing increases in our vaccine numbers day over day.
So that being said, how do you feel about the overall pace of vaccinations?
Yeah, well, we wish, of course, that it had been faster. We do worry as our hospitals are getting stressed and full of COVID patients that we know that some of those In fact, most of those could have been prevented if those people had gotten the vaccine. So we wish that we'd had more vaccines early on, but we're happy to see people getting vaccinated now that get good protection within weeks. But for right now, of course, we are just hoping to continue to urge Idahoans to consider the vaccine as we see Delta cases surge.
We're just at 48% of those eligible being fully vaccinated here, and the numbers are higher around the country. But could so many people here and around the country and around the world unvaccinated lead to the development of new variants, and how much more dangerous could they be?
Yeah, one way to think about it, we all know viruses mutate, constantly. Some viruses faster than others. They do mutate, and the more people that are infected, the more virus there is out there, and the more chance of new mutations to come up. So just decreasing the number of people who get COVID is the most important thing we can do to prevent these new variants from coming forward. We know there will be more variants. We don't know what they'll be like. We don't know if they'll be more severe. We don't know if they'll be more infectious than Delta, but the variants will keep coming as long as this disease is circulating.
Why is the Delta variant so much more contagious? I've read that it's about 60% more contagious than the previous strains.
Yeah, so the current thinking is we all have heard of the spike protein on that virus now. This is the part of that virus that the vaccines are really targeted towards. That spike protein on the surface of the virus is how it latches onto our cells when it's infecting us. There are some changes in that protein that makes it able to latch on a little better and get and also the virus spreads from cell to cell a little faster because of some of those mutations.
We've been reporting that like 98 to 99% of COVID-related hospitalizations and deaths are of unvaccinated people. That would seem to be an indication that the vaccines are effective in keeping people from getting really sick and dying. How do you see it?
Yeah, that's exactly right. We hear stories, we hear people say, well, I know someone who had the vaccine and they still got COVID. And I try to think of an analogy that I think makes sense to people. I think about something like a seatbelt. We've all known people who were wearing a seatbelt but still got injured in a car accident, or even rarely severely injured in a car accident, even though they're wearing their seatbelt. But most of us say, you know what, I am reducing my risk. By putting that seatbelt on, I feel confident that I'm doing everything I can to be as safe as possible. And that's how these vaccines are too. They're not 100%, but people that have been vaccinated can feel more comfortable that they're very unlikely to end up in the hospital. They're very unlikely to end up dying from this virus. And if they do get COVID, it'll probably be a much milder case than they would have had.
Well, Dr. Hahn, we're having a little bit of an audio problem right now with the connection, so I'm going to go to a break right now. We'll see if we can get that straightened out, and we'll continue the conversation right after this. Thank you.
Thank you.
All Denny's pancakes are made to order with fresh buttermilk, but this month's Spotlight Stack is a patriot. Fresh, sweet, and full of freedom. New red, white, and blue pancakes. This month's Spotlight Stack. See you at Denny's.
Well, Geico's 85 years isn't just about time, you know. It means experience. I mean, put it this way. If I told you I'd been jarring raspberry preserves for 85 years, what would you think? Well, at first, you'd be like, that has got to be some scrumptious jam. And then you'd think, he looks fantastic. I must know his skincare routine.
Geico, saving people money for 85 years.
Big bud.
At Fred Meyer, we take scrutinizing freshness to a whole new level, where only the best of the best of the best will do. But just because you can't get any higher than perfect 10 produce, that doesn't mean that we won't try. Because Fred Meyer produce isn't just fresh, it's fresher than fresh. Fred Meyer, fresh for everyone.
I'm Corey. I'm a dairy nutritionist here in the Treasure Valley. I decided to get vaccinated because I wanted to do my part to protect myself and my family and my customers from COVID-19. As soon as the vaccines were readily available, I was vaccinated. I would encourage people to do the research, listen to the healthcare providers. When I went to get my COVID-19 vaccine, there was hardly any wait. It was an easy process, is readily available. Since I got vaccinated, I'm confident I'm protected against the COVID-19 virus. My life has returned to business as usual.
Impossible.
Zero Sugar Chobani is here.
Zero Sugar Chobani has zero sugar?
Zero sugar.
Define zero.
And it's lactose free.
Naturally.
And 60 calories?
Impossibly delicious.
Impossible.
And welcome back to Viewpoint. I'm Doug Petcash. Today we're focusing on the ongoing fight against COVID-19 amid a surge of cases with the Delta variant and how contagious it is. My guest today is State Epidemiologist Dr. Christine Hahn. Dr. Hahn, thanks for your patience as we got that technical issues ironed out. So getting back into that conversation, are you getting any indication as to when a vaccine may get approval for emergency use in kids under 12?
Yeah, it's not quite clear. The last I heard was that the FDA had asked the vaccine manufacturers for a little more information and to enroll some more kids and to follow them a little longer. The reason for this is because in the older kids, 12 and above, there was a concern, and there is a concern about a rare but potentially serious concern about myocarditis, which is inflammation of the heart from the vaccine. And because of that, the FDA is being super careful and wants to make sure this vaccine is safe when it is approved for this age group. So initially we were hoping by this fall there might be a vaccine for these younger kids. That's clearly unlikely to happen at this point. Now most experts are saying it might not be till the winter time, January, February, that type of thing. It's always hard to predict. It depends on how well the studies go, how long the FDA takes to get through their processes. But we're expecting it'll be more likely to be winter.
U.S. officials recently recommended all vaccinated Americans 18 years and older who received either the Pfizer or Moderna vaccine get booster shots 8 months after their second doses. Why 8 months?
Yeah, so actually, that's a very interesting question. You may have noticed the White House came out with this announcement, and we are used to hearing these announcements from the CDC. So I think there's a little bit of now discussion going on if 8 months really is the right time frame. The 8 months was looked at initially, the drug manufacturers, the vaccine manufacturers, Pfizer, Moderna, they've been following those patients in their trials all along to see how long does that immunity last? When do we start to see antibody levels drop? When do we start to see those people who are vaccinated start to have these breakthrough infections? So those manufacturers have been watching this all along, and I think they had estimated it might be at about 8 months based on their data. But I've also heard 6 months, and that's one thing that the CDC's Advisory Committee on Immunization Practices will be discussing. There's a meeting on Monday that they'll be talking about this a little bit, and they will be meeting again in September to really talk about, okay, who needs a booster? When is it? Is it 6 months, 8 months? All that kind of thing. So it has not been finalized yet, is the way I'd put it.
Okay, so still waiting for it to come from the FDA and the CDC. Are boosters being recommended, though, because the effectiveness of the vaccines against the Delta is lower than earlier variants? I think they were 90% effective against the first strains and now just 66% against Delta.
Yeah, so the boosters are being recommended because the observation, first out of Israel, they vaccinated their population very quickly, so they're sort of ahead of us as far as having their population vaccinated. The data out of Israel started suggesting that the vaccine started performing less well over time. People that have been vaccinated were starting to have some breakthrough infections. Again, Israel's data also said, hey, those people are getting infected, but they're still protected. Well protected against hospitalization and death. So that's very reassuring. I want to keep emphasizing that point. But that data did suggest that the effectiveness wore off. It's hard to tease apart, and scientists are trying to do that. Is this because of the Delta coming in, which is what's sweeping across the world right now? Is it because of the Delta, or is it just a matter of time, that over time this vaccine was going to wear off no matter what variant was out there at the moment. But Delta probably plays a role, and some studies suggest that the Delta in particular is probably part of the reason why we're seeing a loss of effectiveness.
I want to recap numbers we showed a little bit earlier about some of the case numbers. As of Thursday morning, the state is reporting more than 216,000 total COVID cases since the beginning of the pandemic. The 14-day average of positive cases per day on August 24th was 661. It's up to 681 now, up from 66 on July 5th. The percentage of tests coming back positive, the positivity rate is now about 13%. It was just 2.8% in early July. Dr. Hahn, how concerned are you about the rapid rise we're seeing in case numbers and positivity rate? It hasn't taken very long at all to go from those low numbers to where we are today.
Yeah, I'm very concerned about the rapid rise. If you look back at the same date, August 25th, August 26th last year, and you think, well, we did have a surge last fall. Maybe this is going to be similar. We're actually ahead of that curve. We actually had maybe about 400 or so cases a year ago, and we're looking at over 1,000 a day now. And our hospitals are telling us that they are at the breaking point. So we're very, very worried about it. The rapid rise, the fact that we have Delta. The good news, the thing that gives us some comfort is we do have a vaccine, that more Idahoans are getting vaccinated, and we know that they have a significant amount of protection from ending up in the hospital. But nonetheless, as you pointed out in your numbers earlier, we have a lot of Idahoans that have not gotten vaccinated, that maybe still have concerns or are hesitant. And so that's why we're doing everything we can to try to talk with Idaho about answering questions, answering their concerns, because we do think the vaccine is the best tool we have. Of course, and I know we're going to talk about masking and social distancing, but the vaccine is the cornerstone to everything.
Let's talk about the hospitalizations, and we have a graphic. I need to update this graphic actually, but last week the state reported 436 people in the hospital with COVID-19, 135 in the ICU. It's a very slight decrease from the previous week, but both still near record highs. And as you said, healthcare leaders say that nearly all of the COVID-related hospitalizations and deaths are of unvaccinated people. You mentioned that hospitals are close to that critical stage. How close are they to a crisis situation and having to go to those crisis standards of care where they basically have to put a number on people and decide who gets the care right away?
Yeah, hospitals are telling us that they're on the brink. Now, what they're doing as they stand there and they're full or over full, they're opening up extra spaces. They're using conference rooms to put beds in. They're keeping people in the emergency department because they don't have a bed for them. And they're meeting daily. We are meeting with them, and they're meeting with each other to share resources, to, if possible, transfer patients. We're very pleased the VA has stepped up and they have accepted the transfer of some veterans from other parts of the state. So the hospitals are doing everything they can to try to keep from having to go into crisis standards of care because they want to keep providing the top level of care that they can for everyone. When they won't be able to do that any longer is anyone's guess. We don't know when that's going to come, but we're very worried that they're going to reach that point.
Of course, it is back to school season now. Just within the last couple of weeks, kids are getting back together. When we're hearing about a higher percentage of kids across the country catching COVID, I have some numbers I'd like your take on as well. An important thing for people to keep in mind is that the youngest students are not vaccinated at all against COVID. As we talked about, the vaccine is not approved yet for kids under 12. Also, a relatively small number of students between 12 and 17 are vaccinated. The state is reporting 20% of Idaho kids between 12 and 15 are fully vaccinated. 28% in that age group have gotten at least one dose. 29% of 16 and 17-year-olds are fully vaccinated. 36% have gotten at least one shot. How do you feel about the vaccination rate among the school age group as the school season starts?
Mm-hmm. Yeah, well, I understand that parents have a lot of questions. They understand that the disease is most severe in seniors or in middle-aged adults, and as you get younger, kids do better. There's no doubt about that. But we do see severe cases in kids. In Idaho, we have had 29 children hospitalized with this multi-inflammatory syndrome of children, and we worry that we're going to see more of those cases as more kids get infected. We also know that being vaccinated helps keep kids in school. I have two kids who are in high school and are both they're both eligible and vaccinated. They flew right through the vaccine, no problem. And I feel much more comfortable sending them to school every day, knowing that they're vaccinated. They're also wearing masks. They're in the Boise school system. And that makes me more comfortable sending my kids to school. But I understand parents have questions. And so what we're urging is, if you're not getting the information you need, or you personally don't feel like that's what something you want to do for your kids, but you're not 100% convinced either way, and you want to talk to someone, find a healthcare provider you trust, whether it's your child's pediatrician, your local pharmacist who might be able to give you extra information, if you have someone in the family or a friend who's a nurse, and just really talk about the data. We do know that most doctors are vaccinated. I always point to that. I'm a physician, I'm vaccinated. Yes, there are risks, but most medical professionals have looked at the data and said, yeah, there's a risk from a vaccine. There's a risk to everything in life, but this COVID virus, especially that Delta, is a nasty virus, and it can cause severe disease in children and hospitalization. Not very common, but having looked at all the information, I myself, and talking it over with my family, our kids agreed to get vaccinated, and I'm really glad we did that.
Now, vaccines are much different, of course, than masks. Do you think school districts should implement mask mandates?
I do think that masks are another tool to keep kids in school. Again, as a parent, last year was so hard, and it was so hard for so many parents. One of my children chose to do online school the whole year, and I don't think he left his room for a year. I felt like so bad. He was so socially isolated at home all the time, sitting in front of a computer. I'm so glad he's back at school. And my daughter did hybrid and in and out, and that was very difficult for her for learning. So my thought is, here's a tool that we know helps keep kids in school. If your kid's wearing a mask, every school district's doing it a little bit different. We just heard from West Ada what their decisions were. But if your child is wearing a mask at most schools, they're less likely to have to be sent home because they were sitting next to a kid or an adult that turned out to have COVID. So for me, and my kids don't find the mask bothersome. I know that that's not true of every child. I personally think the mask is a really important step to help keep kids learning and safe.
I'm curious. Your department handles so many other infectious diseases and health issues besides COVID. Has the debate and so much attention being focused on coronavirus vaccines impacted the pace of vaccinations for other childhood diseases?
Yes, last year, not just in Idaho, but across the nation, of routine vaccinations against, measles and mumps and tetanus and all that dropped. And part of that was, parents were keeping their child away from medical settings. They didn't want to go into a doctor's office where there might be other sick people there. So we totally understand why parents were less likely to bring their child in for their routine immunizations. The CDC and the health departments are now working with pediatricians to try to get kids back to get caught up so that they are not vulnerable to those other infectious diseases.
So we only have about a minute left. I want to leave you with the opportunity to tell us, what do we need to do to stop this latest surge and to someday bring the pandemic to an end?
Yeah, so I really hope all Idahoans will, if they haven't been vaccinated, will seriously look at getting vaccinated now. The surge is real. It's really stressful. When you go into the hospital setting, you can see how overwhelmed they are. The risk is higher now than it was last summer. It's higher now than it was a year ago. I know we're all tired of it, but number one is, I would urge you to consider getting vaccinated and talk again with your healthcare provider if you have questions. Number two, I still go, now I was so happy for a few months not to do this, but I'm back to wearing a mask when I go out in a public space. That is the CDC recommendation because the Delta virus is so infectious. So even though I'm vaccinated, I'm not worried that I'm, going to get severely sick or die. I think that's highly unlikely, but I don't want to accidentally spread it if I should be asymptomatically infected, and I don't want to catch it from anyone else. So I'll wear a mask when I'm in any public setting.
And Dr. Hahn, we'll have to leave it there. Good advice there. Thank you so much for your time. I know you're super busy. Appreciate you.
Yeah. Thank you so much.
And I'll be right back.
Introducing the Jonathan Lewis Design Lab at RC Willey. Using our in-store app, you can easily build the sofa or sectional of your dreams. Create one-of-a-kind pieces and select the fabric, seat depth, silhouette, and legs. Make your room pop at RC Willey.
Hi, if you're on Medicare, you gotta hear this. I watch a lot of TV and see a whole lot of commercials about Medicare benefits. So I finally called to see if I was missing out on any extra Part C benefits and if I could really get money added to my Social Security check. The agent said I'm eligible to eliminate copays and also for several extra benefits, including transportation, meals, expanded dental and prescription coverage, all at no extra cost. Plus, I'm eligible for $1,500 a year added to my Social Security check. I was like, wow, thank you so much. Call right now to see if you're missing any extra savings, benefits, and money you deserve. I trusted the Medicare Coverage Helpline. You can too. Call now. It's free.
Call 1-800-213-9227. That's 1-800-213-9227 now.
For 35 years, Bathfitter makes it easy to remodel your bath or shower.
Hi, I'm Bill Booman.
And I'm Rick Booman from Bathfitter. From your free in-home consultation to your installation, we're with you every step of the way, all backed by our lifetime warranty.
Bathfitter's exclusive seamless wall surround gives you the look of tile, slate, or marble. You'll love the result.
Save time and money with Bathfitter. With 3 locations, we serve all of Idaho.
Call now and receive up to $450 off or 18 months no interest. It's better with Bathfitter.
Horizon Credit Union is dedicated to giving back because your path is our purpose. Banking at Horizon does good in the community. Discover the difference. Visit us today at hzcu.org/discover.
You can find more of our reporting on the COVID situation on our website, ktvb.com, as well as comprehensive graphs on COVID numbers and trends. Another great resource for numbers on people vaccinated, cases since the beginning of the pandemic, hospitalizations, and the COVID trends is the state's coronavirus.idaho.gov website. That's coronavirus.idaho.gov. That's all of our time for this week's Viewpoint. Thank you so much for watching. I'm Doug Petcash. I'll see you tomorrow on Wake Up Idaho and right back here next Sunday morning for another Viewpoint.